So I want to thank the organizers of this conference for allowing me to make this presentation on the largest refugee population in Africa, specifically the South Sudanese in Uganda. I have got no disclosures to make for this. The outline is, we are going to look at the profile of Uganda a little bit for people who do not know Uganda. And then we look at the Uganda and the refugee policy and focus on Bidibidi settlement, which is the largest camp in Uganda, and viral hepatitis B in Uganda and South Sudan. And then we look at a brief survey that we conducted in 2018 on hepatitis B. Uganda is this little country in East Africa, and it borders South Sudan on the north, Democratic Republic of Congo on the west, and then on the south we have got Rwanda, Burundi, and Tanzania, and on the east, Kenya. I mention this because most of our refugees actually come from DRC and also from South Sudan. Uganda has got a total surface area of 241,000 square kilometers. And the 41,000 actually is basically swamp and water. Total population is 46 million as by this year, with a fertility rate of 5 live births per woman and a GDP per capita of $694. Now, in Uganda, we have got the third largest refugee population in the world. We host actually about 1.4 million refugees, most of whom are from South Sudan. And the reason is why we have all this huge number is because of the surrounding areas. Many of the countries surrounding us have been undergoing conflicts. And also the country has got very favorable refugee policy. For example, a new refugee coming into the country who has been screened and allocated a settlement is given a plot of land for the livelihood and is free to move around and has got ability to run even businesses. Some of them run large businesses in Uganda. In terms of the country of origin of these refugees, South Sudan, of course, forms the largest. We have 885,000 refugees from South Sudan, followed by the Democratic Republic of Congo, 418,000. And then we have other countries, Burundi, Rwanda, Eritrea, Sudan, Ethiopia, and all these contribute to the refugee population in this country. And that is by October, end of October this year. Now, you can see from this map that most of the refugees in Uganda actually are around this area, which is in the northwestern region of Uganda, called also the West Nile region. And the little triangles here are the settlements, and the little huts are basically the screening centers. The big blue circles are really representing Sudanese in these different settlements in the country. And so most refugees in the country is actually found in that northwestern part of Uganda. In terms of the district of origin, district of location of these refugee camps, we have got Yumbe. Yumbe has got the biggest refugee camp, which is the Bidibidi camp that I am going to talk about a little bit. And but the others are Jumani, Madio, Kolo, and Terego. All these are in the northwestern part of Uganda. The rest of the country has got camps, but they are not as big as the ones that we have in northwestern Uganda. Now, this in the red map here is actually representing the Bidibidi camp, and it is the largest camp in this country. It is in Yumbe district. It covers 250 square kilometers. It is home to over 230,000 refugees, and most of them are refugees. Now, about hepatitis B, in Uganda, we've had 2 surveys. One survey was which was conducted in 2004, which placed Uganda to have 10% as a population with hepatitis B. But in 2019, we had another survey which now has 4.1% of Ugandans having hepatitis B. This distribution, however, varies from region to region, and you can see in this that there is a north-south gradient, with the northern part of Uganda having the highest percentage of those with hepatitis B compared to the southern part. And because the northern part also borders South Sudan, there is a belt of northern Uganda and South Sudan with a high rate of hepatitis B. In South Sudan, there was a report in the year 2007 that showed 29% of pregnant women had hepatitis B. Another report mentioned that over half of the mothers who were actually born, of the babies born to surface antigen positive mothers, were found to be infected. Again, confirming the high risk of early childhood transmission of hepatitis. In 2018, we conducted a small survey. We recruited mothers 15 to 49 years attending antenatal clinics in Bidibidi refugee settlement, and we screened 200 pregnant women for the surface antigen and anti-core antibody. What we found was that the mean age was 27 years, 96% of these mothers were married, 85% were housewives, and 84% were of the Nuer tribe. Now, again, for people who may not be knowing, Sudan has got two dominant tribes, the Nuer tribe and the Dinka tribe. Now, the Dinka is actually the ruling tribe right now in South Sudan. And you can therefore also think that it is possible that there is that conflict between the two tribes, which will push the Nuer to move out of South Sudan and eventually end up in Uganda. But the overall prevalence of hepatitis B in the pregnant women we found to be 15.5%. And what are the implications? There is a higher prevalence of hepatitis B in this population than in the host country general population, because we are now talking of 4% in Uganda and we're talking of 15% in that population. And so routine screening of pregnant women for hepatitis B would represent a first step towards the prevention of mother-to-child transmission and implementation of birth dose and antiviral therapy for selected mothers. Using e-antigen and viral load testing would be very crucial in this population. So the next steps would be to understand really what is happening in this population. For example, we need to understand the epidemiology and risk factors of HBV among the pregnant women in Uganda and also in the refugee camp, and the reasons for this regional variation, where we have a high prevalence in the vulnerable population, and also in the different parts of Uganda as well. The best methods for care and treatment of persons infected with HBV also needs to be studied. We are trying to study integrating hepatitis B in the existing HIV services within the country, and we hope we shall be reporting these results also soon in some other conferences. However, all interventions towards HBV infection elimination has got to be aligned with the Ministry of Health strategies for sustainability purposes. So in summary, Uganda houses a huge refugee population. South Sudan is the main supplier. Hepatitis B prevalence is very high among the refugees. And in order to reach elimination targets of WHO, specific strategies need to be adapted. Thank you very much for listening to me.